R AskReddit by Lurker. Doctors of Reddit. What is the weirdest thing a patient wouldn't admit? One of my lecturers told us a story of when he worked in ED. There was a man who refused to acknowledge or tell them how a jug got stuck in his rectum. They were taking him to the OR as it has created a vacuum seal and couldn't be removed without shattering, but realized his BSL, blood sugar level, was off the charts. Really high. They were considering postponing the surgery to work out WTF was going on. When he ended up talking, he told them the jar was full of honey before it got lodged and was rapidly absorbed by the rectum, causing the insane levels. What? Oh bother. I admitted a guy for chest pain. As part of the workup, I did a urine drug screen which came back positive for cocaine. After the rest of his cardiac workup was negative, I said to him, "Good news, you didn't have a heart attack. It's likely that your chest pain was caused by cocaine." His answer, "I didn't use cocaine. See, I was at a party and people had some lines of cocaine out on a table. As I was walking by, an oscillating fan blew the cocaine into my face, which is why my urine was positive. MMMHMM. Got it?" Not a doctor but a nurse. Had a patient come in with a toothpick in his penis. Refused to tell me how it got in there, insisting he was picking his teeth and it fell in. Trauma surgery rotation. Surgeons are helicoptered out to the scene where a man is impaled on a tree. They are hoisted up to cut him down in conjunction with firemen. The branch lodged deep in his ass, and the surgeons return on helicopter. In the ED, straight to CT for pan scan. It's in there, as in through his glut max, minutes. Pelvic alar, and the tip of this branch is lodged somewhere alarmingly close to the bifurcation of the iliac, external and internal. He's hemodynamically stable and talking, saying, "My ass, I need meds." A doc is like, "No sheet." Asks him, "What were you doing in the tree?" His answer, "I used to trim trees." "Okay, but were you doing that today?" "No, but I used to trim trees." Utox is positive for meth, but it's time to get that baby out, so it's stat or for IND and slap-ish. I get to scrub in and see what it's all about in the OR. The branch is indeed lodged between the iliac artery and vein. At the bifurcation, neither vessel is damaged. We proceed to remove wood chips and bone chips from the enormous hole we have excavated out of his ass, and no suturing practice for me because it's a wound vac for this man, who used to trim trees. In the following days he is in and out of a med-induced haze. We ask him over and over, "Yo, but what were you doing in the trees?" His reply, "I used to trim trees." He came clean about the meth use and other drug use. He started to look better and better as he basically detoxed before our eyes. He eventually left in as good health as one can be, with a giant mass of granulation tissue where your ass used to be. Never told us why the frick he was in that tree. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and pointed him to the bathroom. I went to check on my other patients and came back. Kid was still in the bathroom. I go knock on the door. "Hey buddy, you okay in there?" Sink on full blast. Yep, everything's fine. I go back to his room a few minutes later and he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. "Hey buddy, are you sure this is urine in this cup?" "Yay. My pee is always clear." PT is wheeled off the x-ray. I check the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little homie, you gotta do better than that. On my surgery rotation as a med student, warning, this is gross as frick. Had a patient recovering from having parts of their bowel removed. As part of the recovery, their intestines weren't completely connected to let them heal better. So the intestines were connected to a little hole in the skin with a bag attached for the poop to go into, known as a colostomy bag. For reference, this woman was in her late 60s and over 230 pounds. I had to round on her every day, and every single day I'd walk into her laying in bed absolutely covered in toxic gasoline smelling diarrhea. She also had C. diff, a nasty bacteria that anyone in the hospital can identify by smell. And she would flirt with the residents and make casual conversation while we would clean the sheet off of her and fix her ostomy bag. One day we walked up to the room and the chief resident walked in the room, immediately walked back out and closed the door behind him. Looked up to all of us following him and when she's fingering herself covered in sheet. I really wish I was making this up. So yeah, she never admitted it, but obviously she was freaking tearing at all the tape covering her ostomy all night until she broke the seal and could get herself covered in sheet again to get attention from the doctors. Had a patient refuse to admit he swallowed a pen, even though an x-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. That's not mine. I'm holding it for a friend. Obligatory, not a doctor. I'm a nurse. We had a patient come into the operating room for brain surgery. Probably a mid-50s guy with a nice head of light brown hair. Before a patient comes into the actual hall, we ask them a series of questions, including whether they have any implants, jewelry, non-hospital clothes on, etc. Guy says no to all the questions. After the patient gets put to sleep, the surgeon grabbed his hair to start shaving it off, because you know, brain surgery, and all his hair peeled off because he was wearing a wig and didn't tell us. We almost shaved his hairpiece because he wouldn't admit to anyone he wore it. This one happened just the other day. Had a patient come in looking pretty sick. Labs and vitals said the guy was in sepsis and most likely had a bad infection. The question was where. After some prodding and letting him know the seriousness of his situation, he finally admitted to the source of his infection. He didn't want to say it, so he just pointed between his legs. Looking underneath his underwear revealed a smelly, red, swollen, pus-draining scrotum. Some of it was even black and necrotic. Not a pleasant sight, and it looked horribly painful. He went on to explain that he had a painful lump on one of his testicles a few weeks back. He was told it was an infection and given antibiotics. The problem didn't go away, and by then he had decided to take matters into his own hands. Literally, he tied a string tight around one testicle and proceeded to cut it out himself. Needless to say, it became horribly infected and was going to require surgical intervention. Guy ended up doing okay. Once had a woman come in for a possible yeast infection. On exam, she had a glass bottle stuck in her vaginal filled with urine. Totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying, "I think this is all a joke and you put it up there." Yeah, she was totally trying to cheat a drug test. Definitely. The bottle had an overly complicated apparatus which allowed her to discreetly trigger the urine to come out, which made it all the more weird she pretended we hadn't just pulled CIA tech out of her cooch. I might be too late for the party. Also, English is not my first language and I'm on mobile. I'm an internal medicine resident. Had a patient with sepsis that was being seen by the urology department. When I first read his clinical history, it stated something along the lines of infected wound in the penis. Patient claims he doesn't know how he got it. So I begin my assessment and ask him about his wound. Indeed, he claimed he didn't know how it happened. I decided that the priority was to stabilize the patient and I made some adjustments to antibiotics and other meds. Well, the guy went downhill. The sepsis became severe even though he was with the strongest antibiotics we had and 2 different vasopressors. His blood pressure was through the floor and eventually he needed intubation and went to the ICU. He managed to survive after a complete penectomy, and about 2 weeks later I saw him again. Turns out the dude was trying to get his dog to lick his penis and put on some peanut butter on it. Naturally, the dog bit him. He didn't seek medical help for about 10 days before the pain and fever was too much. If we knew from the beginning that the wound was inflicted that way, the antibiotic would have been different. Probably would have made a difference. I still feel sorry for that guy, but with a wound like that he is lucky to be alive. Edit. I should have said that a total penectomy is total removal of the penis. Sorry for all of you that went to Google Images. I volunteer at a prisoner shoved a ballpoint pen up his urethra to get out of being stabbed. If I recall correctly, insisted he had no idea how it got there. We spent hours deliberating how to get it out, and he just reaches down, still in his handcuffs, and pulls it out himself. Edit. You can't get stabbed if you're not in the prison, and any sort of self-harm will land you on suicide watch, which is brutal as well. Weird sex stuff though, no problem. I'm a CT tech and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even ask none, so no exceptions. She denies up and down she's pregnant. And then, after the test I did, it said she was. She denied it and demanded a blood test, since she was a lesbian and never has sex with men. Well, the blood test came back positive also. Surprise. And the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. Edit. Because I've gotten this comment a lot. The woman in the room with the patient was her so and they had been together a long time. And the patient had given her so permission, in writing, to allow her to hear her medical information. Many of you are saying you shouldn't have told her in front of her so, and you're partially right in a way. But the patient had given her so that permission. And I did not question it. Had she not, I would have asked her so to leave the room. You can give anyone you deem necessary access, or no access, to your medical information. It's not limited to spouses. Thanks for watching, peeps. If you enjoyed, shove that like button up your, just kidding. Drop a fat like and subscribe for more videos like these. Check out some of the other content on this channel below. See you next time.